Get started now. Today we have Dr. Williams, Dr. Huyer, and Dr. Brown. This briefing is on record for 1 hour. Dr. Williams and Dr. Brown will give some remarks, and then we'll go over to the phone lines. One question, one follow-up. I'll turn it over to Dr. Brown now.
Thank you. We're here today to present some information really about restating some of the numbers that we've been looking at, talking about what are very clear accelerating trends in all of the indicators of the spread of the pandemic, to present what is a more worrisome and challenging and dangerous picture than we would have presented a week ago. The first thing that I want to touch on is restating or looking at the numbers about the case growth in the province. When we presented numbers last week, we noted that this was starting to parallel the worst case scenarios that we were modeling, with about another, we believe, 800 cases attributable to a backlog in testing. This number is now higher, and the curve continues to increase in terms of its steepness. The second thing I want to note is that we are seeing a dramatic growth in the percent of tests that are positive. So the number of people who have a test, the number of those tests that come back positive is also growing. It's over 2% right now. But perhaps even more important is that we see an increasing trend of positivity in tests for people who are older, and it's there in that older population where both the consequences for health and the consequences for the health system are most severe. To provide a little more information on this, we were seeing substantial spillover earlier on, but when we look at the population and exclude those under 10, where the rate of positivity is lower, you see a sharper increase in positivity. And when we start to look at, say, people over the age of 60, that rate of positivity is now 1.4%. That is more than a threefold increase across that same group compared to the last week of August. So cases growing, and actually growing faster than we initially stated last week. The percent of tests that are positive growing again in a very sharp way. And this is all against the background of relatively consistently strong testing numbers, which when we see a situation of high test numbers, high case and growing case numbers, and high positivity, that tells us we are very clearly in the middle of a second wave. I want to also talk about, not just those leading indicators like tests and the percent of those tests that are positive, but also touch on the rate of hospitalization. As most people realize, one gets the disease, develops symptoms, and then those symptoms worsen to the point of requiring hospitalization. Really over the last 3 weeks now, looking at that lagging indicator, that indicator that changes later, of hospitalization, that is now at about 250% growth over the last 3 weeks, 249% to be specific. This is a substantial increase now both in our leading indicators like cases, but also in our lagging indicators like hospitalization. This also carries implications for ICU use, for intensive care unit use. And we look at intensive care unit use because it's a very firm, hard indicator. However, it is, other than mortality, really our lagging indicator, the one that will change latest because there would be the worsening of symptoms, the entry into hospital, and then the entry into the intensive care unit. In all of our scenarios now, both our best case scenario and our worst case scenario, the number of ICU beds occupied by COVID patients crosses the 150 bed threshold. This is the threshold where we believe that we begin to see implications for the ability to provide other surgeries in hospitals. And in our worst case, all of these are actually cross that threshold within the next 30 days. And in our worst case scenarios, it crosses other thresholds that really lead to the reduction of access to hospital care. The importance, though, of understanding the spread goes well beyond its implications for hospitals. Obviously, there is, when people are hospitalized, when they're in the intensive care unit, that is the population where we're going to see probably the highest mortality rates, but they also force out or squeeze out other care, both immediate important care like hospitalized or surgery for cancer or surgery for heart disease, but also preventive care and access to other care. Moreover, when we see the rising rates in the community, we also see rising rates in places like long-term care homes, where our most vulnerable are. And we're now starting to see that rise in cases, not a significant rise in mortality yet within long-term care homes, but a rise in cases in long-term care homes, both for residents and for staff. And we know that the community spread is the single best predictor of adverse outcomes and deaths in long-term care homes. However, this is not, I'm presenting statistics for the entire province that present a very threatening or worrisome picture. This is not universally or equally spread out across the province. In the 3 or 4 public health units that have the highest rate of growth, you can see a very, very, very steep trajectory of all of these indicators, looking really kind of at that point like where the hockey stick turns and starts to move up. If you look at a more middle risk of our public health units, there is a growth, but it is a more gentle curve. And if you look at the remaining public health units, roughly a third to a half of the remaining public health units, it's a very flat curve still in terms of these indicators. What this tells us is that you really don't want to do anything at a province level at this point. You do need intervention, but it should be more tailored to the level of risk in the public health units that we're looking at. I think also important to kind of look at what is happening around the world right now. Virtually every jurisdiction is dealing with a second wave. Many of them entered this second wave long before we did. And there's a clear pattern in the way that jurisdictions intervene in that second wave that determines either whether it gets out of control and rises really at a continuing exponential rate until it leads to a full lockdown, or whether they intervene earlier with hopefully a shorter and a less harsh period of interventions. And you can contrast the experience of countries like Germany with those of Australia, and you can see a sustained and early intervention leads to at least as far as we can tell in the data right now, a lower level of a surge, lower obviously levels of implications for hospitals, long-term care homes, and mortality, and also less harsh restrictions at that point. Even countries that have been holding out, for instance, like the Netherlands, have recently reimposed a series of restrictions that will be very similar to those that will be discussed later on today. Trying to hone in, though, and look more carefully at where these infections are coming from. We've been looking at data from public health units, like that from Toronto, and it's pretty clear pattern, again, in the data that helps us understand where it's most important to intervene. First, the vast majority of the outbreaks, as at least of October 5th that we had information on, were clearly occurring in community or workplace settings. Essentially, and this is I think the key part of what this data shows, those settings where it is indoors, it is difficult to consistently wear a mask, and it is difficult to consistently physically distance. And I think it's important to kind of note those 3 elements to what we're looking at here, because there is, at this point of growth in the epidemic curve, there is not the opportunity to either test more or contact trace more as a way to suppress or control the epidemic. At this point, it really requires public health interventions to break that chain of transmission and allow the numbers to come back down, where case and contact tracing and testing become a very critical, as always very critical, but can become a stronger part of the set of interventions. When we look, though, within the Toronto data at that community and workplace setting, and we break that down further, there's a significant number as well that occur in dining, bars, and entertainment. Gives us an idea where some of the discourse has been coming from the last little while. But again, it's again this sort of strong transmission as we look across public health units in those places where you cannot physically distance consistently, where you are indoors, and where you cannot wear a mask consistently. I'll also add that we've tried to understand recent reports out of the Centers for Disease Control, a little bit of small case control study that actually tried to understand this, and this confirms this view of the importance of these sorts of challenging indoor settings as a primary vector, as a new piece of information that we've got now. What I'll also say, though, is that at least again looking back, say in the Toronto data that I already talked about, the lowest source of outbreaks was actually schools, suggesting that although children can transmit the disease very easily, those are not the sources of the outbreaks, and that those are actually relatively staying under control. What I think this means as we look forward, or what we believe this means when we look forward, is that every jurisdiction around the world is facing a second wave. Jurisdictions that are intervening earlier are actually getting better control over the pandemic or the epidemic within their country. And in the setting of Ontario, we can look at the highest risk settings as places where we can probably keep schools open, but significantly restrict those areas where there is strong amounts of indoor time with the opportunity for transmission because of difficulties in maintaining public health interventions, and urging people to stay at home in those high-risk regions unless they need to be out for essential reasons. may at this point give us a chance to actually get on top of the current spread of the epidemic, and as well in those sort of intermediate risk areas, getting ready there so that hopefully they do not convert into high-risk areas, but if necessary, converting them into high-risk areas with the same restrictions. We would argue that schools can stay open. It will be important, though, I think, to understand the nature of the transmission of infection in schools a little bit more, where we do see outbreaks, and there's some further studies that might help with that. With that, maybe I'll turn it over to Dr. Williams.
Thank you, Dr. Brown. And as I said in our media earlier in this week, that advice coming from the scientific table and from the modeling experts from Dr. Brown and his teams has been most valuable, as well as from our public health measures table. And I had received recommendations from them. We also then went to the health units and asked them for further information and data that would support the areas that they were concerned with, and with consultation. So as a result, when we're taking some changes now, and my advice up on that was on 3 grounds. One is, what do you do with those health units that are in the highest amount of cases per 100,000 that have gone up very rapidly and very quickly, and that irregularly every week now, every day, comprise about 71% of our total numbers in the province. And as Dr. Brown has alluded to, it's not homogeneous throughout the province. It's very much varied in area to area. So we have ones that are basically fairly quiet and acquiescent at this time. We have ones that are in this middle ground, and we have our 3 top ones being Toronto, Peel, and Ottawa that continue to go up very quickly with their cases and numbers and counts and percentages. So at Ottawa, when cases per 100,000, for example, has gone from 54 to just under 62%. 62 per 100,000. Toronto went up quickly from 70 to 71 from 58. So these are rapidly moving, whereas some are way down low at a lower level. That's just only one metric that we use to look at and watch this happening. The case positivity, also concerning, that while the province was at before around about 1.2, 1.3, it has moved up to 2. But even those areas we're concerned about, they have moved up from 2 to 3% positivity throughout Toronto, throughout Ottawa, or throughout Peel and Ottawa close behind. So these are very concerning, and this is data that has supported us in that way. So as a result, our advice is on 3 grounds. One, how to deal with these high level ones, and we've made very specific recommendations that I'll note in a moment to deal with the issues that Dr. Brown has noted, where there's indoor congregate type settings where wearing masks continuously and consistently has not taken place. I will add that if everybody had adhered to all our public health measures around distancing, mask wearing, staying at home if you're ill, social circles down to the details, and that these type of steps and public health measures would not have been necessary. And it's our hope that throughout the rest of the province, besides the ones we're recommending moving in some direction now, if people adhere and follow those in all these settings, we may not need to take any further steps in that matter. Because as Dr. Brown alluded to, you can't test yourself out of it. You can't case contact your way out of it. You can, by adhering to standards, keep yourself out of it. And that's what we want to see, and we want to see that happening in the next number of days. The steps that I'm asking, the measures I'm asking, is in the next 28 days, 2 incubation periods, we're going to be asking our high-risk places to step down to a modified stage 2 level. That means certain recommendations we're going to bring forward consistent with what the modeling group and what the scientific table has put forward. And I'll mention some of those to you at this time. We're going to be asking to look at those venues in those 3 areas. And this has been supported by the local medical officers of health, where they have evidence of outbreaks and concerns, and where they have not seen consistent behavior, and they want to restrict that at this time down. And I want to restrict that from our public measure table and also from the recommendations of the scientific table to look at that. So gathering limits, we still have our thing with 24 outdoor and 10 indoor. We're trying to keep those numbers consistent because some were saying as you varied it too much, people got confused. Restaurants, a topic of big discussion, and as Dr. Brown has alluded to, in the scientific data, they found that there was evidence of, in recent studies, of transmission in restaurant settings, that your risk goes up by 2.8, and so it is not insignificant. So we're going to ask that in those areas that they, while the restaurants stay open, and their patio services with their pickup and curbside services, that no indoor dining in those facilities for the next 28 days. We're saying that gym and fitness centers, because we've had outbreaks related to group activities, we want that closed at this time in those settings, those 3 places of Toronto, Ottawa, and Peel for the 28 days. And with casino, bingo halls, and gaming establishments, we also want those closed as well. So we're recommending that, as well as cinemas, to stay closed. Meeting and event spaces, they can have 10 a maximum, but we're asking that might be effective to be closed later in the week to make sure that we don't have that occurring in large banquet settings. Performing arts and racing venues, the public closed at this time. We want to keep our schools open. That's why we're saying this does not impact schools or post-secondary school institutions. We know it's important. And part of that I will premise on the fact is that as we get the community transmission down, it keeps those safer for the schools, as Dr. Brown has alluded for. So these are valuable investments. We want to keep it down for our long-term care homes, not to be impacted. So these are investments going forward to keep these institutions safe and open, that we know that data supports their importance. We're also saying in retail services and malls, we want to keep our stores open, but they have to do care and protection as they have, and with spacing and masking and that. We're asking the malls to then switch from their food courts to being sit-in to just being takeout only, and you have to take your food out and other places to eat in that location. We're also looking at things around tour and guided services, as well as open houses or retail things that details will be following shortly. We're also asking not to impact those school functions. Schools in their activities writ large, including child care centers, preschool and post-school, are not being touched. Those are important and critical, but they have very clear guidelines and direction and things to follow and handle those ones, not only in the 3 throughout Ontario, and we want that continued and maintained consistently. We found outbreaks related to team sports. We've asked that that not be taking place in the 3 areas we've talked about. That means contact sports and that. You can have individual training type things and things where you have like children's learn how to skate stuff, but not competition where we've seen outbreaks and activity related to that. And also large other gatherings such as museum, galleries, zoos, and science centers to limit the activities so the personal contact can be brought down under control during this 28-day period. So we have come up with strong recommendations because we have seen that the public health measures worked in the first wave. The difference is in the first wave, we did those on top of a lockdown. We did those on top of a schools being closed. We did well. Now, can we do it again with our schools open? Can we do it again with our retails open? Can we do it again with a number of things being there? Can we do it in certain strategic areas in high-risk zones? Also giving a warning to those that are close around that, you may be impacted soon if your numbers go up accordingly. So we need to be focusing back on, because the tool, if we get everybody doing what they should be doing, then the demand at our assessment centers drops. Because if you don't have an exposure, you haven't followed everything honestly, and you have not been exposed and no signs and symptoms, you obviously don't need to be tested. And that decreases the load there, gets it back down, gets our turnaround time intact. Also, the load on our case contact managers drops, because in the first wave, people had an average of 8, 9, or 10 contacts only. As I said in my press conference yesterday, now they're saying quite commonly people have 30, 40, 50 contacts, up to 100 in the last 5 to 7 days. That is totally not acceptable, and it becomes impossible to do all that, as Dr. Brown alluded to. We cannot case contact ourselves out of that. And so that will help to bring that under control and get our turnaround time even better. So these are the things that we're going to be carrying forward on that, to say, in this time, in 20 days, can we ramp this down, especially in these 3 high-risk areas of Toronto, Peel, and Ottawa. And we have been in conversation with their medical officers of health, who are highly supportive, and they are going to work from in their own respective jurisdictions on the areas of priority to continue to drive that down. We have our general messages, again, about public: don't go out if you don't need to go out, don't travel if you don't have to travel. So over 70s and immunosuppressed people, be careful, be cautious on who you're contacting, especially in these high hot zones for the next 28 days. And then the general public writ large, the same message we said all along: do it again, do it well, do it consistently. We've done this before. I think we can do it again now in this second wave. As Dr. Brown said, every sector of the world is experiencing these second waves. Let's show that Ontario can do it successfully as well, with the data we have supporting us and the scientific evidence as well. So with that, I'm going to hand it over to Any comments from Dr. Huyer or for general questions from the media?
So the only comment that I'm going to make is built off my two colleagues, prevention. We want to prevent spread, and we want to prevent that in every way possible to stop people from being sick, stop the potential of it spreading into the long-term care homes and the schools.
Thank you.
We'll go to the phone lines. Just a reminder, one question, one follow-up. Over to the first question, please.
From Ashley Legasic at Newstalk 1010.
Hi there. I'm wondering if you can just break down what essential is classified as. Like, work has been classified as essential, but is that all work that isn't mentioned in today's announcement? What about non-essential businesses like construction? What's the advice for them right now?
So our public health measures, on there we are closing, asked to close where there is indoor gathering, where people cannot, as Dr. Brown has given the evidence for, consistently maintain and have not maintained masking and social distancing. So all the ones we're recommending today to assist in this activity is based on that. So we're not going after selective retailers. There's rules around construction sites with occupational health and safety. The role of the Ministry of Labor has in that function as well. We did not recommend that at this stage here because we have not seen outbreaks in that regard, but we have seen in these interior congregal type settings where, especially in these 3 zones, there has not been consistent adherence to standards. So we are selecting those ones in particular.
Follow-up?
Thank you. And there have been a lot of calls for transparency. The public wants to actually physically see the data that these decisions are being based off of. Why isn't that data being released today?
So the data, and as you can see, Dr. Brown was alluding to all the different data from other sectors of the world, literature and research data. We have talked about there's a variation throughout the province with rates per 100,000, R naughts or REs or RIs and different terms like that. There's growth and rapid spread in how fast it's going up. There's aspects related also to percent positivity in these areas and even subgroups there. There isn't an exact formula. There's the things compiled and also the rates of changes, and Dr. Brown may want to comment on that. When you're looking at these flows, and he's alluded to the speed and rapidity of it, and how does it compare to other jurisdictions. So it's not that there is a formula that people can just plug and play. There's a combination of different data points that takes a scientific group and a modeling group like Dr. Brown's group to take that analysis forward and give us recommendations. Perhaps you'd want to comment on that, Dr. Brown.
So much of the data that I shared today is already available in the public domain. There are some more analyses that we will put out. We're just going through these as quickly as we can, and all of our science table work actually is made transparent on our website, usually a few days after we finish the analyses.
Next question.
From Travis Danraj at Global News.
Hi there, doctors. Can you hear me?
Yes, we can.
Yes.
Okay. What specific evidence did you not have last Friday that Toronto's medical officer clearly had when she recommended that many of these measures that you're announcing today be implemented immediately? And essentially the question is, what took so long to do that, despite the fact that other medical officers were saying, we need this done now?
When we had discussions with the Toronto medical officer, Dr. Eileen Davila, on Friday, we heard of her concerns about some of these specific venues. We asked at that time, could we get some data that would support these different ones and give evidence of that? And that was late on Friday. And so over the weekend and early in the week, we were asking them to supply us with that data. We looked at our sources within our own aspects of that data, as Dr. Brown, and may want to comment further, to carry that forward, because in the paucity of some data points, we needed to have some analytics and modeling that the science table and the modeling table were able to give us, and further scientific and comparisons that was compelling and showed us the evidence that we had to move quickly on, and The fact that between Friday, remember we were coasting and staying steady around 500, upper fives, and things weren't progressing. We had a backlog in the, and maybe Dr. Huyer would like to comment on that, a backlog on some of the data points in that, and then all of a sudden on Monday, Tuesday, Wednesday, our numbers of positive tests really started going up exponentially in the percent range very rapidly. So we had a number of things together that drove us to the commentary we have today and given advice and direction up for further action by the government.
I think really important to focus on what Dr. Brown and Dr. Williams have talked about as far as gatherings. So a lot of the focus came on to restaurants, but this is about gatherings. This is about people being together. Restaurants take many different steps. So as many of you have known who have observed restaurants, they have plexiglass, they have tables separated, they have many hand sanitizer at the table. The staff are very careful to be intersecting carefully. This is about gatherings where people are in close proximity without masks, in a position of more relaxed, with friends, laughing, talking, and sharing some time together, and not unfortunately recognizing that there's likely a greater opportunity and a greater propensity to spread. One of the studies that Dr. Brown referred to was there was a clearly increased risk on a careful analysis of people at a gathering when they're in close proximity. So this is additional information that we've gained together, all of us working together to try to get the best answers to understand what are the approaches that should be taken. These are tough decisions that many decision makers are taking, and many different pieces of advice are required to make those decisions.
Follow-up?
Sure, yeah, if I could ask a kind of a double-barreled question here. There's been criticism about the messaging and the public messaging when it comes to public health protocols that people should be following, especially when it comes to gatherings, etc. Do you take any responsibility for that? Do you think that you could have been clearer with that messaging? And also on schools, we know the transmission rate is rising in schools. At what point would you consider recommending shutting down schools, and is that on the table?
So on the messaging, I would have to disagree. I think the messaging has been clear. We have been trying to communicate that again and again to the public on that. I think our issue around some things with social circles, that was seen to be handled very well during May and June. And then in July, people had decided to become very liberal with that, and for whatever reason decide to say, set that aside, set aside the 6-foot distancing, set aside the masking in backyard gatherings and social gatherings. So I wouldn't say that the message was confusing. I think sometimes the public is saying, we're having difficulty because we want to reinterpret it in a way that we seem as meaningful. We have changed the messaging recently to say we're going to have to hone back down from the social circles to the household because we really have to ramp down because of our numbers going up. So I think our messaging has been clear. I think what we have to do is in ways we're trying to really address how to get to the various demographic groups, because a lot of our increase was in the younger age group. And sometimes that messaging has been less than clear, and we want to work on that. And so that's that aspect. As far as schools are concerned, as Dr. Brown has alluded to, we haven't seen the evidence of a lot of transmission within the schools. We have evidence of a lot of people coming from the community into the school already infected. And so far, our system that we set up with the Ministry of Education, with our public health units, with our nurses in the schools, has been very quick and rapid to move on those cases. And a lot of the school ones deal with 1 or 2 people that have been contained either through the cohorting and by then moving people out and doing testing. So we haven't seen a lot of transmission in the schools, yet we do have people coming from the community already positive into the schools. And so, schools have been closed and schools have been reopened. So that is happening dynamically. And as Dr. Brown said, these impacts of this community, which has impact on schools, is not homogeneous throughout the province. Some areas it's very low, hardly any transmission. 24 of our 27, or 24 to 27 have less than 5 cases per 100,000. So they stay low. So writ large movement is not merited this time. So we'll continue to monitor the schools, work on our definition of how we're handling that, seek any areas of gaps of how we're doing case contact management, schools, daycares, preschool, post-school. These are all important, and so far they've been doing well. We got to keep at it. We got to keep vigilant and keep working at it. If the case numbers go down, it becomes less of an issue in the community, less of an issue for the schools.
Next question
is from Jeff Gray at the Globe and Mail.
Oh, hi, thank you. I wanted to ask if you can tell us if any advice, any recommendations that you've made or the public health measures table or the science table have made to the government, to the cabinet, that were there any that they rejected and didn't do today that you can tell us about?
I mean, I can speak for the science table because we've given you all the recommendations that we've made. They've all been taken up. The staying at home, the need to focus only on essential travel, the need to look more closely into schools, just understand the nature of the transmission, and the need to break the spread of infection by, fortunately, restricting areas where there is close contact without masking in indoor environments.
follow-up.
Yes, maybe just Dr. Williams, or, should there be, some people are saying that in the interest of transparency, that Public Health Ontario or Dr. Williams or the Public Health Measures Table should reveal to the public what they think needs to be done before the government then decides what of those recommendations it's going to implement. Is there any merit in having a system like that?
You have to understand, in the process here, the advisory, or the Public Health Measures Table advises myself, and then my responsibility is to advise the government. That means up to the Minister of Health, and then that goes on further up into the Premier and Cabinet for decision-making. I would have to say that our advice, pretty well of what we brought forward, I would think nearly everything was accepted by Cabinet. We gave them information and advice and scientific data in that and for their decision making. And so the process is that because it requires, these are regulations and going up for amendment of the ROA, we can't talk about that ahead of time because that's advice given to the government for consideration. And so we have to follow due process in that manner.
Next question
is from Graham Richardson at CTV Ottawa. Please go ahead.
So if I hear you correctly, this decision was based on data from Toronto Public Health. I appreciate the numbers in Ottawa are uncomfortably high and disturbing, but speaking to the mayor yesterday, and the last I heard from Dr. Etches, they were not in favor of closing restaurants and bars. So why did you do that in Ottawa?
So we have consulted with Dr. Etches and more recently with Dr. Malofny, who is now acting because Dr. Etches is away. We've had extensive discussions. I would agree that while Ottawa felt in the cadre of different recommendations around gatherings, as Dr. Huyer's alluded to, while they understood that some, and we've had input from Ottawa, we've had input from Peel and from Toronto. So it wasn't just Toronto only in that. And from their input, they said these different ones are important. Some of these are more important for here or there because it depends on the experience in different jurisdictions. They understood the merits of having the different ones brought in there, including that while restaurants were not as important to as the top choice for in the cadre of things we're asking to do for Ottawa, they could understand in a precautionary basis why it would be important and for the 28 days to do that. They had some other areas that Dr. Etches was very strong on that even Dr. Davila was maybe not as strong on, but still understood why that was important. So the three medical officers of health, while saying in their experience, because it just depends on what happens in your areas, could all understand why each one of those has an impact and how doing it consistently in the three brings out the message that Dr. Huyer was alluding to, that if everybody focused back down on prevention and people get the idea that congregate activity is not to be applauded, especially without lack of proper protocols and procedures in all these settings, is an important message. And the sooner we pull that down and get the numbers down, because just because it's not here today, it won't be in this other setting tomorrow, and it keeps working its way around. So we have consulted and continue to consult with all the medical officers of health in those three areas for their input and direction and any data they would want to add and give more advice to us in that matter.
And we're certainly hearing across all different jurisdictions, both in Ontario and outside of Ontario, how significant the social interactions and social gatherings are when the properly applied public health measures at the individual level, which is the person who's wearing the mask, the person who's washing their hands, the person who's staying 6 feet away from somebody else. Those are the proper and individual public health measures that each person needs to take, and think about taking those when they're entering into a situation. We certainly have heard and seen social gatherings in various settings across the province where this transmission has occurred.
Follow up?
Peel said don't do this. Ottawa said don't do this. I appreciate social gatherings are a problem, but anecdotally, I've heard the bars have been packed in Toronto, and they were not and are not packed in Ottawa. What do all of you say to a restaurant owner who has spent thousands to stay safe and to stay open, that they are being targeted unfairly because of a problem in another city?
I would have to say we've talked to Peel, Ottawa, and Toronto. They all said yes, not no. While, as I said, they have different areas of priority. Peel knows that some of their people have gone over to Toronto and have come back infected. They know if we close Toronto, they'll come over to Peel, and they don't want to have the same activities. So the proximity is very concerning to them. And so in that, Dr. Lowe had said, I would say yes. So Dr. Lowe did not say no, he said yes. And Dr. Malafny also, on behalf of Dr. Etches in Ottawa, said, while it's not a top issue at this time for us, we would also say yes on a consistency across the 3 areas. Our concern is that people will be consistent both in those institutions and outside. It's the broader issue, as Dr. Huyer's alluded to, that gives the overall message that to ensure if we're going to have these gatherings in the future, what you do personally, individually, is very important. You cannot be irresponsible, and it's the overall messaging there, because each one of those are dealing with huge numbers. Their staff are getting overwhelmed with case contact management. They can't keep up on it because a number of people have not been responsible, and as a result, then this moved back to a modified stage 2 in their minds in all the different venues. While there's different ones and priorities in each one, they said it does make sense and they agree with.
Next question.
From Mike Crawley at CBC News. Please go ahead.
Hi, Dr. Brown. You mentioned that what's happened really in the course of the last week has been an acceleration in the rate of new cases. Could you try to describe what has changed in terms of what your projections are? A couple of weeks ago, the projection was that Ontario would be seeing 1,000 new cases by mid-October. We're clearly headed in that direction. What has been the impact of this delay in imposing stricter measures on where we're going to be with new cases by the end of October?
Sure. So it's a little hard to do the counterfactual analysis and say what if, but the longer that there is a delay between a growth in cases and the imposition of public health measures, the faster that curve starts to accelerate and the sharper and higher it goes. What you see perhaps is a good indication of where we're thinking there's a big impact now. In all of our scenarios, we get into a area where we're compromising our intensive care units right now. And so that's a pretty good indication of some of the change of what the acceleration means. Of course, just to kind of reiterate, cases are maybe a lead indicator. Hospitalizations and ICU use are a lag indicator. They change a lot later. So even acting now, we're still going to see some acceleration in hospital use. We're going to see some acceleration in ICU use because those are people who are already infected at this point.
Follow up?
I guess this is to Dr. Williams. Could you explain some of the reasons why the restrictions are not being applied to places of worship, and also why the restrictions are not being applied to York region?
So we have the places of worship for the actual worship service and these rights and that. We already have those in place constitutionally. For the 30%, we have actions put in place. The different centers have not noted outbreaks related to those actual services and events. It's the after events, such as if you have a a service for a wedding, for example, it's the after reception and party in different locations. That is more the problem that we've seen. So we haven't impacted that at this time, the services, that is, in those settings. What is York Region? We have seen their numbers getting close to where we want to consider. We've had discussion with the medical officer of health, Dr. Kurji. He understands they're fairly close to the edge there. And we have a number of other ones around the Greater Toronto area that are moving up and close. And we have had discussion with those medical officers, and they say, we really do agree with what you're putting in for those. We're not there yet. So we have the warning that if we don't get things under control, that may affect us as well. And they said, we appreciate that kind of message. And so they want to really drive that forward. And I think Dr. Kurji would like to say, while it may go into joining the other three, he would like to work assertively with his public and with centers to see if he can bring that back down again and stay away from having go into a modified 2. So we've had discussions with Dr. Kurji in York Region.
Next question.
A reminder to press *1 if you do have a question. And your next question will be from Steve Paikin at TVO. Please go ahead.
Can you guys hear me okay?
Yeah, hi, Steve.
Hi.
Yes, we can.
We can't hear you now, though, Steve.
Next question.
Will be from Rob Ferguson at the Toronto Star.
Hi,
Please
Rob.
go ahead, Rob.
Yeah, sorry, I was just getting off mute. Doctors, just wondering, how did this all of a sudden take off and get away from you? We've had the Hospital Association and other health experts warning for a couple of weeks that things were getting bad, and it seemed to have taken you guys by surprise.
So I wouldn't say by surprise. I mean, we were trying to watch the numbers there. As you know, we've been slowly hedging up from the end of August, with going up from under 100 in mid-August to 150, 180. And it looked like, because we took steps to put in public health measures on the 19th, on the 25th, and then last week, to keep ramping up the different restrictions and social gatherings and groups and that, bars closing by midnight, last drink at 11 o'clock. We take a number of steps to see if we could nudge everybody towards saying this has to be done. And I think when you're looking at the data today, and I know Dr. Brown might comment on that, these numbers today were actually 5 to 7 days ago, and we had the issue with the backlog with the lab tests and looking at those metrics as well. So there's a number of things there that all of a sudden, as we're coming out of it, we were plateauing around 600, and then the last 2 days, we went up about almost 200 each day in the testing one there. So that gave us a reason to really say we have to be serious and take some moves fast to curtail it on that one there, whereas there is some evidence that we could be up on plateauing and leveling. But with now lab testing getting more current and more up to date, those numbers really took off, and the percent positivity went up very quickly in this last week. And that was where our scientific table looked at that and did the analytics and said, this is very concerning, especially in the recent events in the last few days. And I don't know whether Dr. Brown wanted to comment on that or not.
No, the curve has been going up for a while. It just continues to accelerate, and at some point, it is accelerating too much. We continue to report on, and I expect even with the imposition of measures today, you will see continued acceleration, and we'll continue to point to that until finally the public health measures take effect. You break the chain of transmission, and the numbers start to come down. And they will come down first on cases, then on other lag indicators like hospitalizations or ICU use.
And I remind everybody and all of us at the table here that public health measures have been talked about on an ongoing and regular basis. And each individual takes public health measures, and all of us are in this together, and we have to think about the measures that we need to take, and we have to think about the situations that we're entering into and the potential risk that we may be putting ourselves into or putting other people into when we take those steps. So public health measures are from the individual on up. There's many different ways that measures are taken, and each person has their role to play, and that role is actually a pretty big role. Everyone here is working together and needs to work together to protect those most vulnerable in our society and to keep the schools and the kids in those schools to be able to be educated and have social interaction and allow everything else to continue forward.
Follow up?
Yeah, sorry for the delay. Thanks for that. Just to pick up on something Dr. Williams said earlier about people seem to be going out too much in Toronto, Peel, and Ottawa. I noticed that people are going to the grocery store to pick up one or two things. Are we going to end up, or how close are we to ending up back at the situation where you would say only get groceries once a week? Limit, and you're already saying limit your movement. So how far do you want to take that?
Well, we have put in our general recommendations to try to limit your outside activities as much as possible, only for essentials. So if that means being more organized and only going out once a week, we would prefer that, especially in these areas. But in general, throughout, to go out in the morning, in the afternoon, and go 3 or 4 times, that means it's more difficult for those establishments to keep the pacing and the distancing if more and more people are just going out and grabbing one thing and 2 things in there, and some are actually doing more ordering and pick up at the curbside and things like that. So I think we have to reinsert that back again. It's that new normal that we were getting good at, and Dr. Huyer's alluding to, we were doing well in May and June into July, and then all of a sudden everybody just sort of started letting it slide. We're back to the old behavior, and we can't do that not only now, but all fall. We have to keep at that same, I would call the new normal behavior, because if you do all that well, the things that you really do want to have available, you can keep having available. And we want to make sure we invest in that. It means a learned behavior, as Dr. Huyer's alluded to. And people have gotten used to masking, but you have to do it here and do it again and do it consistently. And so I think what you're getting at, Rob, is that yes, we have to refocus on how did we get success in the summer. Let's go back to that and let's reinvest in that again. Because we want to do that going into the fall, and also we'd like to think how we can keep some things that are certain functions like seasonal celebrations and that open with the new normal, not with a throwing off and saying, let's be careless. That we've seen, that does not work. It did not work, and we're seeing people have to go back in it. I will say, I still think there's some people, many Ontarians, saying we have stayed at the task. We have done our part. And I applaud you for that, and keep at it, don't give up. But they have been seen and writing letters saying, we see it, we're doing it, but we find these and these and these people are not doing it. You need to be coming down on that. And so we're trying to be as firm as we can. Dr. Huyer's alluded to that, to say, refocus, let's do what we did, let's do it again, let's do it well, and keep the things we want open that we want to keep open.
I think, Rob, you've really hit on an exact example of something that speaks to how people should be thinking about what they're doing. Thinking about every step that they're taking when they're going out and when they're intersecting with other people. Make those decisions. Make those decisions in the framework of trying to ensure that we prevent or reduce any potential chance for infection. Thinking about the situation, evaluating where you're going, evaluating the steps of intersection, evaluate what you can do to prevent any potential situation of spread.
Next question.
From Steve Paikin at TVO.
You're back,
Can you guys
Steve.
hear me now?
Yes,
We could hear you before. Don't mute this time, Steve.
Okay. This technology is all beyond me, I'm afraid. Forgive me if you've answered this, but I just want to confirm 110%. Pickup hockey games, for example, rec hockey games, indoors in hockey arenas, even if players have masks on, that is now no longer allowed?
Indoors, that's correct.
Follow up?
Outdoors fine, though.
Outdoors, it's more that the activity, we haven't really addressed outdoor at this stage. We have talked about indoor venues at this time. It's more sometimes the pre-game and the post-game activities that have also not been consistently followed with spacing and distancing. So to be honest, we have not yet considered outdoor at this time.
Next question.
Will be from Colin DeMello at CTV News. Please go ahead.
Hello, good afternoon, doctors. I'm wondering how you manage the geographical issues. So someone who can't go to a gym in Mississauga can now go to Oakville. Someone who can't get married in Toronto can go up to Vaughan. How do you stop that from happening without, having police kind of come in so that those communities don't go from medium risk to high risk?
So that's been an area we've tried to look at and concerned about with jurisdictions that are adjacent and bordering. It not only affects around the GTA, it can affect some of the other areas around Ottawa. And what they're trying to say is that if we have enough monitoring that, we would ascertain if the people are coming in and not adhering to the behavior that's supposed to be in those. As we said, we have discussed it with the surrounding health units, and they see the need to say, we're going to have to be, even if we're not in those 3 zones, we're going to be emphasizing these same points because we need to be really buckling down. And as Dr. Huyer's alluded to, people have to follow right behavior. We haven't put in travel restrictions. We've asked people from those areas, if it's not essential, don't travel out. So we've discouraged that. At the same time, we're going to be monitoring that situation and see what occurs, but they're going to be bringing that messaging out, whether it's your regular patron or another one, they have to follow the rules. And as I said before, everybody followed the rules, we wouldn't have some of the difficulties we're facing now with the community transmission. So it's a good question. It's one that's been raised, and one we have had discussion with the surrounding health units and their medical officer of health who are aware of this and are going to be monitoring the situation very closely.
Follow up?
Okay, and if I can ask a question on behalf of my kids, Halloween is at the end of the month, so what is the advice then? We know in the hotspot regions Halloween is probably canceled, but what about in the non-hotspot regions? What's your advice for Halloween?
The Public Health Measures Table hasn't yet put out its guidance. We want to get through Thanksgiving on Halloween. We haven't said that even in the hot zones it's canceled outright. I'm going to wait for some direction from them of how people have ideas that in the essence of it, what's necessary. Like people say, well, can we still decorate the front lawn? Sure you can. Can people drive by and see all your, what you've done creatively? That's not a problem. How would you do things? So we've had lots of good suggestions that it can be done with the distancing, with the spacing, and caring that. And so it's a question as with the other things, there are certain things that are valuable and people would like to have if they can do it in a safe way that doesn't change that contact. So I would be saying that I haven't got the direct recommendations because what you do in Toronto, you should do out in York, you should do out in Halliburton and anywhere else. So I'll wait to get those recommendations, but they're not included in today's.
Next question
is from Randy Rath at CHCH TV. Please go ahead.
Hi. Further to Colin's question, I take it that you're not ruling out putting in travel restrictions in the province in the future if it's necessary. And also, should people from lower risk areas avoid travel to the higher risk areas? So
we haven't put travel restrictions within Ontario at all anytime during the pandemic, just because we know that it's a very difficult one to control in that regard. At the same time, it's a big province, so to take a jaunt up to Thunder Bay just to go for a gym class and back down again is obviously not possible. And so we have this huge geography, we have a varied geography and different facilities and activities. We did do some limitations, as you heard in the summer, when people were going up to Cottage Land, and we asked people to not go if they don't have to. I'm not going to reiterate all those. And I would say people did adhere to that. There were some people who didn't. We did find it out, but most did respect that. We're asking people to respect that as well with now, if you're from our areas here in Toronto, Peel, and Ottawa, to limit your travel. We haven't said that people shouldn't come in if they have essential services to come in for and see, because the concern has been around these congregate settings that I wouldn't say that you should come in and then frequent bars in Toronto and that, because they're not going to be open. And so I don't think we've entertained travel bans in Ontario at this time. We've asked people to limit their travel for essential things, and because this is for a 28-day period, and we want to see if we can really bring things under control in those 28 days.
Follow up?
And isn't it tempting fate to have not put these restrictions in the other larger urban areas like York, Halton, Hamilton? Isn't it just a matter of time until their numbers catch up with the real hot zones?
It's why we had the discussion with them, and we asked if any of them felt right now they should be entering that. They said no, but they don't mind being noted around there that they have had some slowly rising rates. Theirs has not been as extensive as Toronto, Peel, and Ottawa. They still have stayed with their percentages. Some have actually dropped down a little bit. It's given them a certain mandate to say, let's really go at these other things aggressively, get our public messaging out, because we don't want to go into that one. And the same message that Dr. Huyer is saying is the same one that said we need to be doing and doing more. And it's for our public to say, you see what happens when you don't do that. And we need to do that very well and do it carefully. So I've had a sense from them, they feel they can strongly support all these ones here to say, and we don't want that, and we want our public in our areas to do all the things that Dr. Huyer is alluding to and that we put in as well. So they know about it, they're working on it, and they feel that they want to drive it down. But we said if it does wing up and head up that way, we've given them notice that we may have to put them in the same restrictions.
And I recognize that I sound like a broken record, but this is a shared responsibility. This is everybody working to take each individual steps that they can take. There are a number of things that are happening, individual level, a public health unit level, a family level, a community level, the provincial government level with the public health measures that are being put in the different places. Each has a role and each has a responsibility, and each needs to think about their own responsibility and take that seriously and work together to evaluate the risk that they're putting themselves into or others into and minimize contact to the extent that is reasonable and to the most important times, as Dr. Williams talked about.
Next question, and this is the last question.
From Randall Denley at National Post.
Hi, I see in your release here that talks about personal care services where a mask can't stay in place. I wonder what you're thinking of there. Would it include dentistry and some of the sort of affiliated health services, or is it just beauty services, or what's it about?
So personal care service doesn't include services provided by regulated health professionals in those settings, and the dental colleges and the hygienists have rules and aspects they put in place for the protection, much like healthcare workers working with patients and seeing patients in different settings. So our different regulated groups have their policies and procedures in place. Personal care things are more like around, like we do with hair salons, nail services, tattoo, et cetera, and there we found that if people do not have to take off the mask and they have their other things in place, that we agree that they can stay open. We haven't seen them as a venue, but it's when someone's performing some sort of a thing in a personal care setting, they're not a regulated official with the full PPE on and different aspects. We're asked at this time, and recommendations from those MOHs, to say, let's curtail that activity at this time because it's an internal place, as Dr. Brown said. If you cannot consistently maintain masking and distancing, those are the ones you have to hold back on and limit at this time for the next 28 days.
Follow-up, and this is the last question.
I'm sure some people are going to point out that you give the example of only 10 people being allowed in a cooking class, which of course is far fewer than is allowed in a school. What is your thinking there? Why 10 is a good number for that, but not for schools?
So in the class, in the cooking class, they can distance some people in some aspects there. The amount of integrity of all the aspects of PPE and the monitoring, I would say at this time, is not as stringent as in our school settings, because we have laid that out clearly with the boards of education, with the Ministry of Education, with the principals and the staff, and in consultation with the various workforce people there, as well as with our public health nurses who are in the schools. And everybody has been laid out with clear guidelines around layers of different protection. So it's a different type thing with the cohorting, with the masking, with the distancing, with the pre-screening going in, staying home if you're ill. You put out new guidelines for screening with the school children. Those kind of things are in place, not the same as for the cooking class. And so that's the integrity of that, and Dr. Brown's alluded to that. We have not seen that transmission occurring in the schools. Part of that is due to the fact that all these different layers of protection are in place. We're continually reviewing that. If we have to make additions to that in consultation with our table, combined with school and education people, with advisors, with Dr. Tepper joining the Ministry of Education as well. So we are continually reviewing those to make sure they're quality, they're consistent, they're happening, and we reduce any potential spread in there. So it's a much different thing with school as compared to a cooking class done by someone in a different setting.
Thanks, everyone.